but I saw her.
Yeah, I don't see her, but I see
Can you
her.
hear me?
Yes.
Yes.
All right. But my computer is not behaving.
I wish my video didn't work.
I'll say for people who are joining us and have a question or comment, they can click the hand icon to raise their hand, or type something in is it the Q&A or the chat that works?
So we do have the chat box as well as the Q&A, and I do have a raised hand here for, let me see, one participant. We have 2 raised hands. All right.
Okay. Well, we need to get started first, yes, before we can. Oops, sorry, my hand was up. Okay. Agenda.
I do have the agenda.
I have multiple screens, but there's still not enough space for everything.
Nope, that's okay.
Now we lost Joanne.
Joanne's not there. Oh, not there.
Oh. Okay.
Yeah, it's not sharing for the agenda.
Okay.
Thankfully,
I'll pull
that's
it
why
up.
I
Hold
am.
on. Here's the agenda. Okay, so we begin with open forum.
So we do have a raised hand for open forum.
Okay.
Okay. Kevin Erickson, you should be unmuted.
Kevin?
Hi, good evening. Can you hear me?
Yes. Can you please give your address?
Sure. For the record, Attorney Kevin Erickson, 4 Land Drive, Westford Road. Westford, Massachusetts.
Okay.
Here representing numerous businesses in the town of Westford in opposition to a proposed indoor mask mandate. I did provide written comments to the board in advance of the meeting, and I understand that those have been forwarded to you. I would like to summarize some of those comments now, but also.
Okay, can we hold this, Kevin, until we actually are off of open forum, or would this be appropriate for open forum? This should be under our COVID updates and discussion of the mask mandate, which is next. So we'll recognize you in a few moments when.
Oh, that's perfectly fine.
Okay, thank you. Was there anybody who had any open forum issues that are not related to our 6 o'clock and 6:10 COVID updates and mask mandate? Ray, I can't hear you. You're muted.
Sorry about that. I do not see anything in question and answer or the chat box.
Okay.
The only raised hand I have right now is Mr. Erickson.
Okay, great. Do we move forward with that? Why don't we go ahead and start with our COVID updates before the discussion, since we're a little ahead of the discussion. Ray and Gail, are you the ones providing our numbers and updates?
Sure, I can start. So we do have 49 active cases here in Westford as of this afternoon today. Just to be clear, those cases are constantly opening and closing, as well as some cases are sent to what's called the CTC, or the Contact Tracing Collaborative. So we do have 2 school nurses, Sue Hanley and Kathy Bordeaux, as well as Gail, working on contact tracing here in Westford. We are in the process too of pursuing additional help of up to 4 people to help with contact tracing as Gail moves into flu season and flu clinics. We have pretty full in October with clinics. So we want to make sure that her time is freed up from contact tracing, and we bring in some more help. I did send all the statistics today from the Department of Public Health with regards to our vaccination rates, not only in the state, but in Westford. If you have any additional questions, I don't know if you have anything you want to add, Gail.
No, not for right now. Thanks.
Sure.
Does anybody else on the board have anything they wanted to say at this time, or would we like to open it up to hear from public? Okay, then seeing nobody from the board at the moment, we'll go ahead and as we are beginning to discuss a townwide indoor mask mandate, which the board had all agreed at our previous meeting that we were in favor of and we're working on the wording of. We'll go ahead currently and recognize Mr. Erickson who wanted to speak.
Okay.
Oh, thank you. And you can hear me?
Yes.
Thank you very much. Again, Attorney Kevin Erickson. First, as I did indicate in an email to this board earlier today, I don't believe that this board can properly take a vote on this proposed mandate this evening. The notice posted by the board states only that a draft mandate would be reviewed. No other anticipated action, including a vote, had been indicated on that notice. So I believe a vote tonight would be contrary to previous decisions issued by the Attorney General's office relative to the public meeting law and would be in potential violation of that open meeting law. I also would say that my clients do take issue with the timing of this mandate. Despite the preamble and the mandate itself, there are positive trends occurring statewide in the COVID-19 metrics that are available in the Mass Department of Public Health. As of September 20th, for example, the 7-day average of confirmed cases is at its lowest point since August 16th. The 7-day average of percent positivity is at its lowest point since July 27th, and hospitalizations associated with COVID are down nearly 10% over last week's high. So while the board does have authority to pass some reasonable health regulations under the circumstances that currently exist in the Commonwealth, we believe a sweeping mandate that ignores vaccination status, impacts all individuals in the Commonwealth aged 2 and up, and provides very little nuance from business type to business type hardly seems to meet the reasonableness requirement. It is worth noting, and this is another positive point, that Massachusetts has the 4th highest vaccination rate for fully vaccinated individuals in the country, and the 2nd highest rate among individuals who've received at least 1 dose, behind only Vermont. The latter represents 76.8% of the total population within the state. So simply put, this is a well-protected residency that does not, in our estimation, require further mandates from this board. Certainly, there is no prohibition right now to any individual wearing a mask in any place of business or other public space in the town of Westford or anywhere in the Commonwealth that I'm aware of, and many do, as I'm sure you've seen out and about. Likewise, any private business does have the right, even now, to impose mask mandates on its employees, customers, and guests. It also goes without saying that any individual can decide whether or not to patronize a particular place of business based on their own risk assessment and personal circumstances. Given Massachusetts' high rate of vaccination, as well as the previously mentioned positively trending virus metrics that I just mentioned from the Department of Public Health statistics, my clients feel that the greatest impact, honestly, that this mandate is going to have is to harm local businesses that have already suffered greatly from mandates associated with COVID-19 in the past 18 plus months. Customers who are opposed to further mandates of this kind, and we expect there will be many, will patronize businesses in adjacent towns and communities where there are no such mandates. Employees who do not wish, for example, to work 8-hour shifts on a hot cooking line while wearing a mask will seek employment in neighboring Chelmsford, Kingsborough, or New Hampshire, further increasing the labor challenges that are severely hampering local businesses already here in Westford and throughout the Commonwealth of Massachusetts. Furthermore, as I mentioned in my email, my clients are adamant that they not be made deputies charged with enforcing this mandate on their customers at the behest of this board. This will result in an alienation of customers, impacting present and future business. It also has the potential, as we've seen elsewhere in the country, to put employees in dangerous situations. An 18-year-old host or hostess, quite frankly, is hardly trained in conflict de-escalation. And we have seen very recent situations, New York City most recently, where employees attempted to enforce mandates and were met with physical violence. We hope that this wouldn't occur, but unfortunately, this is the reality that we're currently living in. Specifically, as to the mandate itself, it does largely appear to mirror the Littleton mandate. I would note that it has an effective date of 12:01 a.m. proposed tomorrow. Maybe that's a placehold, but it does seem highly inappropriate given that this meeting is being held just 6 hours earlier. Also, in my opinion, and the opinion of my clients, the portions of the mandate, as I just said, requiring staff to supervise and enforce the board's mandate on its customers are inappropriate and potentially unsafe. Furthermore, unlike the Littleton mandate, there's no horizon date provided. An open-ended mandate of this kind, limited only by language that states that the board will review the mandate at each subsequent meeting, seems highly inappropriate. There's no defined off-ramp provided in this mandate, which Littleton at least attempts to provide. And frankly, that's concerning for my clients. If this board is considering a mandate now when percent positivity is on the lower end of 2% statewide and statewide ICU bed availability is at 25%, what is the limiting principle exactly? Businesses and their employees cannot and should not continue to bear the burden of these mandates. As time passes, I think the consensus is becoming clear that COVID is here to stay in some form or another for the foreseeable future. Thankfully, there is a freely available and effective vaccine. Treatments for the virus has also continued to improve. We believe that at this point in the pandemic, personal agency, personal risk assessment, and common sense should once again become the governing principle, not sweeping mandates that continue to place the burden and harm on local businesses and that, frankly, vary from community to community, creating competitive disadvantage. I appreciate the board's time. I hope that the board will consider indefinitely tabling this mandate. I know at previous meetings there was broad sweeping support for it, but I would just suggest that the business community needs to be considered in this regard. Personal agency needs to be considered in this regard. And we believe that this is not the appropriate time for such a mandate. Thank you.
Thank you. Appreciate your words. Do we see some more people with their hands raised? You're muted, Ray.
We do have one more gentleman.
Okay, Joanne would like to make a comment.
Okay.
And I apologize because I got frozen and then I had to go out and come back in. So I don't know if, because of the nature of what we're discussing, and I'm feeling if we have a lot of people that are speaking, did we put a time limit on speakers so that we
Did
can?
not. Shall we, is it reasonable to say until 6:30?
Well, I don't know how many people, are either registered to speak or want to speak, so you may want to limit them to like 5 minutes, or I can't see that, so I don't know. Just to make sure everybody has their chance and somebody doesn't,
Right. Yeah,
Okay.
right now we have 16 attendees, and one other gentleman has his hand raised. And so I don't know if you want to set a limit to so many minutes per speech.
Okay.
Up until 6:30 and then we can move on or something like that.
Joyce, is 5 minutes then a reasonable limit to set?
Sure. Okay. All right. So next speaker is Scott. Go ahead, Scott.
Yes, hello, can you hear me?
Yes.
Okay. 2 Powers Road, Westford. I feel that mandating masks isn't warranted at this time. I feel that's...
What is your last name, Scott?
Oh,
What is your
sorry.
last name?
Pelletier. Pelletier.
Thank you.
You're welcome. I feel that masks aren't warranted at this time. I feel that's why we all got vaccinated. That was the whole reason behind it. And as the previous speaker said, Massachusetts is one of the most vaccinated states at over 80% in the United States. And no one is telling people they can't wear a mask if they don't want to. You certainly may. It makes it very difficult to explain to my employees to wear a mask when in Dr. Fauci's emails, he states that they don't work. The head of the NIH, National Institute of Health, in an interview on August 17th of this year, said there's no scientific data showing that masks work. Also, a study done this summer in Florida shows that after 45 minutes, masks are breeding grounds for infections, bacteria, mold, and fungus. How can I, as an employer with good conscience, ask an employee to wear a mask for up to 8 hours a day on a hot kitchen line, especially when during the state of emergency, which we are not under currently, they had to take frequent breaks outside to take the mask off because they were having reoccurring headaches from wearing the mask. We as small businesses have been taking hits for going on 2 years now, which was supposed to be 14 days to flatten the curve. I've seen multiple posts on the Westford pages today and yesterday from people who won't go to places where masks are required. Especially we can go to surrounding towns or up to New Hampshire. So in ending, if there is for some reason a mask mandate implemented, I would appreciate some citing of recent scientific data to be distributed to people in the town so I can pass it on to explain the reasoning behind it to my employees. It would be nice if there was some hard scientific data showing that masks work, maybe citing a study, not just people's fears. I feel that everybody's been vaccinated, everybody that wants to, and everybody can wear a mask if they want to. Thank you very much for your time, and that's it.
Thank you, Scott. Just to address at least one of the issues that you raised there, or two, perhaps people 12 and older have had the opportunity to be vaccinated, but those under 12 have not had that opportunity, and we are significantly concerned about them at this point in time. In addition, if anybody is able to go to the CDC website and see what the recommendations are there, which, let me find them on my computer. If you read, the CDC says everyone in Middlesex County, Massachusetts should wear a mask in public indoor settings. That's everyone, not only those who are vaccinated. Mask requirements may vary, but you should follow local rules and guidance. Our percent positivity is significantly higher than the average in the state. In fact, quite dramatically higher than that average in the state. Those statistics are readily available at the Massachusetts website. I can share some of them now, but it's not hard to find. Westford's percent positivity currently is at 3.49% compared with the county, which is, according to the CDC, at 1.3%. We have concern in our town and in many of our neighboring towns. Okay, so I see one hand raised. Is that someone new, Rayer? Muted again.
It's Scott. I had an additional comment to make.
Okay, Scott.
Go ahead, Scott. Scott, are you still there?
Yes, I am.
Okay, there you go.
Okay, okay. Yes, thank you. Thank you for giving me a rebuttal. There was a study out that children 0 to 17 have a 99.9975% recovery rate if they get COVID. They have more of a chance of getting in a school bus accident and dying than they do of dying of COVID. But they are still currently taking buses to school. So I just wanted to throw that out there. Thank you very much.
You're welcome. Yes, they may have a good rate of recovery, but the amount of time that they end up missing school and the dramatic impact because of missing school on their learning, their social and emotional health, and quite a few other issues is of significant concern. I thought I saw Joanne and then she disappeared. Oh, Joanne, would you like to speak? There you
are. No, I actually raised my hand by mistake. I'm not, but I will say I just want to make sure that I get the process down. We want to go through all of our speakers first because I've been taking notes. I do have comments about what some of.
Okay, do we have any more?
We do not have any hand raised. We do have a question. Michelle Troy. Percent positivity is highly related to the amount of tests taken. If one sick person takes one test, that's 100% positivity.
Yes, I think we're all quite aware. Yeah, there are a lot of metrics and a lot of statistics, which I think many of us have been following and are quite aware of, because no one statistic perfectly captures the situation. It's looking at a variety of the data points. And we will note that, yes, as many people have mentioned, Westford has good vaccination rates for those who are able to be vaccinated. And that is excellent. We need everybody who is not yet vaccinated, who lives or works in the town, to get vaccinated. It's important and it needs to happen. But we also have a significant chunk of our population which cannot yet be vaccinated and are at risk. So seeing no other, there's still one hand. Is that another question?
Joanne's is down. Yep, so we have Anna Lockwood. Let me unmute her.
Hi, my name is Anna Lockwood. I reside in Lunenburg, but I have a business in Westford. That's Prime Fitness and Nutrition. And we recently, we actually are requesting now immunization proof from all of our members, of course, our staff, and our team, we are going to start testing regularly because, you know, it's getting scary out there and we want to be part of the solution. We don't have any concerns about us. If there's a mask mandate, I know that, you know, we're a group of women that will follow the rules. We have been doing that for a while. We actually kept masks on until mid-June instead of in April or May when the mandates came off. And our staff were wearing masks until July. And now we're back at wearing, our staff is back at wearing masks. I'm not against the mask mandate. This is personally, but I wish that if there's a mandate in place, that the mandate is not a blanket mandate, because I think that's not helping us move forward with getting people who's not vaccinated. So if there's a way to create a mandate where if business are allowed to if business requests proof of immunization, they are not required to have masks inside. And I'll tell you, many of our members are already wearing masks inside. And this is not about our business. This is really about getting an incentive for people who have not got the vaccine yet to get the vaccine, because we know that's the problem. So if you were to enable to enact a mandate, I just ask to have a consideration if there's a way to have a mandate that it's not a blanket mandate of just masks inside for all indoor activities, but rather mask indoors for indoor activities if no proof of immunization is shown. So that's my only comment. I'll just say too that, you know, we made this decision of requesting proof of immunization from everybody. And I know this is it was not an easy decision to make, but it's a decision that affected, 200 women and their families. And you guys are in a much tougher spot. Like you said, you have consideration for kids. We understand that. So that's all. Thank you.
Thank you, Anna. All right. Do we have anybody else?
We do not.
Okay. Seeing no one else, why don't we go on and move towards, I don't know if we want to do comments from board members. Sue?
Oh, I have a few comments, and I'm sure, I know, Joanne, you had written notes too. So for each person, I actually have a couple comments. For Kevin, yes, you're right. We have a very high vaccination rate, but unfortunately, we have a lot of breakthrough right now. And I'm a school nurse and I'm a contact tracer, and that's been a big problem right now for the breakthrough. And what's happened, and in my experience doing contact tracing, that all the cases I've worked that have tested positive, it has started from somebody unvaccinated. I am completely in favor of vaccinations for all, and I can't wait till the children can be vaccinated. Unfortunately, we have no control over who gets vaccinated and who doesn't, but we have control over wearing masks, so those who are not vaccinated will can't lie, so to speak. We all wear masks, then we're all universal here. Scott, I have to say some of the things you quoted are just not true. Fauci made that comment back in October of 2020, so you might want to go back and see that that is outdated. And in terms of masks causing infection, also not true. Again, you might want to go back and check all that. And what you shared about the children, that might be true, but you don't work in a school and you're not dealing with the fact that, as Stephanie said, these kids are out of school for weeks on end. I've done contact tracing with families that I have a family right now that the unvaccinated 16-year-old came in, brought it into the house. Mom and dad were vaccinated. Mom and dad eventually tested positive, which then extended the quarantine for the younger children. One of the younger children then got it. Now she's home 10 more days. By the time she's able to go back to school, it's going to be 3 to 4 weeks out of school. So it's easy to say these kids are not being hospitalized, and that's great news, but it's causing a huge issue in schools. I am one of the people on this board that is completely and unequivocally in favor of masking for right now. Anna, thank you so much for what you shared. I couldn't agree with you more, and I wish that we could just start putting it out there. If you're not vaccinated, you can't do X, Y, Z. And I think it is something as a board that we will take into consideration maybe at our next meeting. But at this point in time, we have talked about the fact that right now, the most important thing we can do to stop the spread that's going on is to make everybody wear a mask so that those people who are not vaccinated and not doing the right thing are not able to take advantage of those of us who have done the right thing.
Thank you, Sue. Anybody else have comments? Zach?
I don't want to cut up Joanne, but just a quick thing. Kevin had mentioned that we are at a low to a 7-day average, but if you look at the bigger picture, I don't think we should be looking at the 7-day average. Numbers up, move up and down on a daily basis. If you look at the bigger picture, it would be great if we're actually trending down, and if we are, that's exactly what we want to be doing, is trending down. But I hope we are. But if you look at last year, we're way worse than we were last year and heading into the winter. So I'm hoping that we are trending down, but if we're not, that's why we're not looking at just 7-day averages here. So I don't think that's that helpful to look at.
Thank you, Zach. Joanne, did you have something?
Yeah, so I have a few things. And again, I apologize for my computer glitches. And I think I came in after Kevin started speaking. So I know that he was referring to we and my clients. And I wasn't sure if he explained who we and the clients were. So when you're talking about a specific business community or whatever, I don't know who you're talking about. So I just wanted to throw that out there. But one of the other things was we can't focus on just Westford. We don't live in a bubble. We don't have a finite amount of people that come in that live here and only stay here and never go anywhere else. We have people that obviously come here to work. They come here to recreate. So typically these regulations are put into place based on regions and regional issues. And I think Stephanie brought up the fact that we are in a region that is not in good shape. So the fact that Westford itself may have a high vaccination rate is great, but that's not the deciding factor, because I know I don't work in Westford, but I live here. So I'm going into another community. So we have to be careful when we say things like that, but this is what's happening in Westford. We're not just talking about Westford, we're talking about the general area and what's happening in Massachusetts. And we do have to look at the bigger picture, as Zach said. We can't pretend we live in a bubble. And the Delta variant is scary. And again, it causes illness, it causes outages from school and work and things like that, that are very important. Masks are not the end all and be all. We've all said that. It is one thing in a toolbox, and it is a layer that we all have to use in order to try to get this thing into control. And if we could pick and choose, that would be great, but we can't. So as Sue said, we really kind of have to do this as an overall, general mask mandate. I know Kevin said something about an end date. Now, I do understand that. We as a board, we meet once a month and we have committed to reviewing it once a month. I do understand having this just be open-ended, and maybe that is something that we could discuss. The community that I do work in has a mask mandate and does have a date at which they will review it every meeting, but they do have an absolute specific date where it will either end or they will extend. So, we could talk about that. I think that would be reasonable. And in terms of the mask things, I think, Sue, you hit, a couple of those right on the nose. And I don't understand the having to wear the same mask for 8 hours in a row. As a nurse, and as anybody who has worked in the healthcare system, unless you're doing open heart surgery that's going to take 16 hours, you are not working in the same mask for 8 hours. And you change them, just like in the food industry, you change your gloves. So, I guess I want to be, it's not an argument that is going to resonate with me. There's no such thing as you have to be in the same mask for 8 hours. And that's why, it is important that you have PPE and different types of protection for your employees readily available. If they want, not to wear a paper mask, they want to bring their own or whatever, that's fine. You give them mask breaks, you let them go outside, or whatever you need to do. But that is not a reasonable argument. So I think maybe we should put that one to bed. Trying to think of something else. I wish we were at the point that we could say we don't need to do this, but I think we are, and I wish that it was more of an even playing field, if you will, that the governor would make it such, but he's not going to. So it is our job as the Board of Health to look out for the residents and the staff and the people who come to recreate, who come to work here. It is our job to look out for the protection of their health overall. And that is what we're doing. That's what I feel.
Thank you, Joanne. Gail, would you like to speak?
Hi, thank you. I am the public health nurse in town, and with all the other fellow panelists, I agree 100%. I do believe that masks are not the end all be all, and it is just, as Joanne just said, it's just another tool in the tool shed. It is what we use to decrease the particles that exchange between two people. It doesn't mean that there's no particles exchanging between two people. It just decreases it. It is a benefit to all. It has decreased the flu and colds of last year. It didn't eradicate it, but it certainly decreased it considerably. So we know, as a nurse, I've been in a hospital for almost 25 years of my career, working with patients at their bedside, and wearing masks do work. We do change them frequently. We do take mask breaks, and that is a recommendation that we would do that, right? We would take our masks off and go outside and take it off and have a breather for a while. Masks are just great barrier devices, and it does help. And it is worth mentioning that we are going now into the fall and into the winter months where viral season is, and we just want to really be cognizant of the fact that it also decreases other viruses and other spread. And as a contact tracer and a case investigator, as I've been doing since I've started this job with not just COVID, but with all other communicable diseases, it is very important to be aware that all these mechanisms that we put in place is for the public's health as a whole. This is not just, we're preventing an individual and their individual rights. It is a public's health that we have to really consider when we make these kind of recommendations. We have to think and look at the whole picture. And that is what I believe we are all here today saying is this is for all of us as a community, as people coming in and out of our community. It's really important that we don't just focus on just individual selves, but as a whole. And I can say as a contact tracer, the cases that I've been working on are vaccinated people. And we can, just like the flu shot, you can get the flu, even with the flu shot, it just gives you a milder case of the flu if you were to get it. And similar to COVID, if you get COVID, hopefully with the vaccination on board, it will be a milder case. But still, there is a risk to people, vaccinated or unvaccinated. And so the mask just adds an additional safety mechanism. Thank you.
Thank you, Gail. Michelle, and then
Thank
Zach.
you, Gail. I thought that was very, very well presented. And I would just like to say for those of us who are vaccinated, if you do get COVID, you are a transmitter. So if you are wearing a mask, you are much less likely to share that viral load, particularly if it's the Delta variant, which has a much higher viral load and is much more transmissible. So being vaccinated is not the ultimate cure. We still need to implement our other control methods.
Thank you, Zach.
Yeah, really good points, everybody. I just also heard a number that came out. I think it was Scott said that over 80% of Massachusetts residents are vaccinated. That is not true as far as the data I've seen. One shot, 76.8%, fully vaccinated, 67.4%. So that is, I don't want to put out misinformation there. The second point is that masks actually do make many customers feel more comfortable going into establishments. So don't make blanket statements that you're going to lose business because of them. There's many people that I've heard from personally and also anecdotally that said they feel much more comfortable going into a store if they feel that everyone is masked. So especially going into the winter, I think you're actually going to find many of your customers feeling much more comfortable going in if they know that that protection is in place. And lastly, to the point of employees having to police, I don't think employees have to police any more than they would any other laws that they have to police to, smoking, wearing sneakers, and so forth. They can point to the sign on the wall and let it go from there. We're not asking them to go above and beyond. They can, call the Board of Health. They can, call in their manager, all the normal steps that they would. They don't have to actively, escort someone out of the restaurant. That is left up to how the management wants to handle it. So I don't think there's any more burden placed on employees than any other laws that are in place in the Commonwealth. Thank you.
Thank you, Zach. Yes, I think Westford has overall around a 77% vaccination rate. We're very high in the groups who can be vaccinated, but there are people in town who cannot be vaccinated yet. So our overall is 77%. That leaves enough of a chunk to have some significant spread. And our language, which we may now want to go into discussing, I also have heard from people in town who have said they have been going to other towns for business because we do not have a mask mandate. So it does go both ways. And we did not, to my knowledge, have anything in our language that we were looking at that asks the businesses themselves to be the enforcers of this mask mandate. Sue?
Zach, what was the number that you had? How many towns have put a mask mandate in play?
The last number I saw was 45 towns in Massachusetts have a mask mandate.
Okay, so I guess at this time, shall we review the specific language? and discuss
Yes.
any amendments to that?
Yep, I'm having a little trouble sharing the screen here, so I know you all have a copy of it, but I'm going to keep working on that.
Okay.
One issue I will mention is certainly a couple things. So one would be the school department had asked, as I had mentioned to Stephanie earlier today, some school committee members had asked if we could at least look at the concern that DESE has a recommendation for face coverings in schools right now up to October 1st. So it says in their actual DESE at least to October 1st. So one of their concerns was if for whatever reason DESE should decide October 3rd, October 1st, October 15th, they want to rescind the mask covering order, will the schools need to fall under the local mandate? So they were just concerned about the gap. So they were recommending some language to be added to that. So that came in about this afternoon. So I just wanted to mention that. The second thing is, if you do decide to go with the mandate, that we put in some kind of effective date that has a little bit of a gap so that we can get the message out to businesses. They can order supplies of masks. That was a recommendation.
Okay. Thank you, Ray. Sue?
Ray, in terms of that October 1st, what you have to remember is that October 1st was that 80% of your school population had to be vaccinated in order for that to happen. So we know that that would never happen at the elementary level. And we also know, even like, for example, in my middle school, I have 256 graders. So I don't think we could possibly even have 80% if everybody was vaccinated who could be. So in some ways, I understand what they're saying, but I think it's going to be a moot point. You know, I can't see this being rescinded at all because the cases are kind of crazy in schools right now. And I'm not saying that we're out of control at school and that we're having a lot of problems with kids spreading in school, but there's a lot of concerns. I would be shocked. There's a lot of issues between DESE and MDPH. And and Gail, I'm sure you would agree with me too. If DESE ever says on October 1st, I think staff at school would go through the roof. I do. So we can put something in there, but I think most of us who work in the school system know that this is not going to happen, and it can't happen at the elementary students. There's no way. So the only schools that it would be middle and high school. And again,
okay.
Yeah.
So it's okay, Joanne.
So Sue, was it? I just want to make sure I word this right. It's for 80% for a whole district, not a grade level, right?
School. I think it was for the school.
So the
I think
fact
it's
that
per
the
school.
elementaries
Per school.
per school. Okay, so the only one it would be the high school. But I mean, the issue there is that the commissioner would have to go back to the council to get permission. Now, they gave it to him the first time. I doubt they wouldn't allow him to continue with the protocol that's in place based on the fact that we still don't have vaccinations for the little ones. So although that's not a guarantee, he did get that accomplished very quickly. So I'd be surprised if that became an issue. But it's easy enough, I think, to, even without any wording, to wrap them into this anyway. Again, in the community that I'm in, the mask mandate came out first, so that schools were already doing it before the DESE came out. So.
How, Joanne? I'm sorry. Do you know what the wording was that was used?
It's pretty much the same as this. Very similar.
But to include the schools?
No, I'm trying to remember the exact wording. It doesn't say it specifically, but because it's for the town, they're in the town.
So that would just be.
It was in the town, yeah, in the town building. So.
Ray, I think we had wording in here that says the schools.
There it is. So let me scroll down here.
Because I hope that they
Number 9.
make that decision. It just seems a little ambiguous in the short term, and we don't want to leave a
Right. So number 9, we have
hole.
nothing in this regulation shall affect the state and federal orders already in effect for Massachusetts and mandates established by the Commission for the Department of Elementary and Secondary Education regarding the wearing of face coverings in school.
Yeah, so basically that says we're not going to do anything different, but the question is if that sunsets, are they still included? I mean, I suppose I could go back to legal to ask the question, but it would seem that they're in the town.
So would we just remove 9, point bullet 9?
Oh, no, we'd leave it.
Mm-hmm.
The question is the opposite. What happens if DESE sunsets? This is saying
Right.
we're not going to do anything different. So we're not going to go in and say you don't have to, even though DESE says you do. So the question was, if the DESE goes away, are they still mandated to do it based on our face mask regulation for the town?
See, I think if we leave 9 in, they would not be.
I agree. I think leaving 9 in gives us the right to do whatever we want in town versus what goes on in the school. Isn't that what you're saying?
No, I'm saying that 9 says that the school department, that DESE supersedes Westford Board of Health.
Nothing. Oh, yeah.
So,
Yeah.
So maybe that we have to think about
Maybe
that.
change that.
I think we need to have it in there, but maybe we need to add to it then.
Town council recommended adding to it. They did approve this draft, and I did speak with them today regarding those concerns. And they just felt that we could add to it and manipulate the language in the sense that we could add to what we want to say if DESE should rescind.
So, I mean, we could add to it where the DESE guidance, let's see,
We'll put something like if
is
DESE
not less than the Westford guidance.
or I'm trying to think of the beginning of the sentence, something about to say, if the DESE guidance, like sunsets, whatever, schools will be required to follow the town masking mandate.
That would work.
But we have to think of the beginning of the sentence. So they didn't,
But
legal didn't give any like suggestions on wording?
Joanne, what is your Lexington? What is it saying? Like,
I don't
what's
have
the
it in
wording?
front of me.
Okay.
But it doesn't,
I think a lot of the towns just don't have that in there.
no, they're part of the town.
Right. So if you remove number 9, it's just, then the schools are just part of the town, is my point. If we
Right.
just strike 9, then the schools are part of the town.
Correct.
The difference is if the state DESE or the feds put something in more restrictive,
Right.
you want number 9 in to say that nothing in this is gonna,
So then we would just say nothing in this regulation. And instead of a new sentence at the end of where the period is after school, we would say where the town guidance is not stricter than the state guide or than DESE's guidance.
state or federal, or something to that effect. Basically, we want to make sure that if that goes away, they have to comply with this.
Right.
So
Why-
Could you say nothing in this regulation shall be stricter than the state and federal orders already in effect?
No, because if DESE does away with theirs, then that leaves that. Right now, this is saying that we're letting DESE set the regulation. So I think we have to say where the DESE guidance is.
Why can't we just strike number 9 right now? And then it's a town or it's a town order. I don't like, why do we have to have that language at all? Number 9, why does it have to be in there?
And we can amend it
Yeah.
when and if we need to.
Correct.
I think that works for me. I prefer that, to just strike 9. And then if the DESE guidance for some reason. Well, no, if we need to relax it, we're going to be meeting and we could make that change when we meet. Like if we don't need masks in school, then I would say we probably don't need masks in the rest of town. So.
Well, and two, there's new guidance out from the governor's office for daycare facilities and whatnot. So I think it is in the best interest of striking number 9.
Okay. Is everybody comfortable with removing 9 then? We'll take 9 out. And I know people had expressed concerns about end date. A lot of the mask mandates I read tied it to the Middlesex rate. I didn't really want to do that because we might be considerably different from some of the other towns in Middlesex and can be more lenient. I really felt that if we're meeting regularly and deciding, we'll be able to change quickly. And
right. So number 11, you'll notice has been changed since the first draft you were sent.
okay.
And where it talks to be punished by a civil fine of up to $300 per violation. Here in Westford, our approach is education first and an opportunity to provide education. And so fining is certainly not our first or ever our top priority. But I agree that it's important to not have all these stages where you're writing a written letter and a verbal letter and the whole thing, and then you're finally making it to fine. So for the enforcement piece, it has been changed to up to.
Okay.
I am kind of in favor of having a date by which, we have to make a decision one way or the other. Having it open-ended is a little difficult. I understand that. From people reading it saying, well, this could go on forever kind of thing. It does kind of hold us to a date. We will be reviewing it, obviously, with every meeting, but, and could resend it prior to, but I think I'd like to see something that kind of has some solid.
So what wording and what date would you propose?
I don't know, Joanne. I kind of disagree because I liked that it says this mandate will be reviewed by the Board of Health at each subsequent regular meeting. I think it's hard to put a date out there and just say November 1st, for example, or where by putting it in the way we have it is we're going to review it at each meeting. So like we have a meeting again in a couple of weeks. Mm-hmm. I mean, so I think the way it's written is actually, our next meeting is not a month away. Our next meeting is a few weeks away because this is this is not one of our typical meeting dates. So I think an arbitrary date is tricky. I mean, that's just my personal opinion. If everybody feels the same way as Joanne, that's fine. But I like the wording that it will be reviewed at each subsequent regular meeting. So that gives us the right, like in a few weeks, to say, you know what, I don't know.
I'm with you, Sue. That's my preference. But
well, and then maybe not a date, but maybe something tying it in to data or.
Okay, well, where is our wording, Ray? Can you scroll to?
Mm-hmm. Sure.
As opposed to just, every meeting, because we could do that.
So it's at the bottom.
Okay.
The bottom of number 11, the mandate will be reviewed by the Board of Health at each subsequent regular meeting. If no action is taken by the Board of Health to rescind it, this regulation will remain in effect.
Zach?
I totally hear you, Joanne. I understand normally I would be in favor of having an end date. In this case, though, either you put in a date like November 1st or something, which I think is kind of misleading. If the reporting is, November 1st, it ends, then people think that it's going to be over on that date, and we don't know that it is. I think that we are accountable because we're going to be meeting at every meeting, and this is going to be on our agenda for every meeting. We are accountable to keep looking at the data. And then in terms of picking a number, for instance, on September 6th, numbers looked really great. They dropped, the cases per week rate dropped to 15.5, but then they picked right back up again. And so it would be great if we picked a number, but then would we then have to just go back 2 weeks later? And, I would like to see, there's going to be a lot of data that is going to start to spell it out for us, I think, when we see the right trend and so forth. It'll be also to do with, vaccination rates and the trend rates and so forth. So I wish I could pick one data point or one number that would say, like, this will be the end of it. Unfortunately, it's not that easy, and it is on us every week, every time we meet to decide this. It's going to be, the public is going to be looking to us. It would be nice to be able to just say, oh, we'll just pick a date and it'll be over, but that's not the truth of the matter.
Yeah, no, I agree.
I think we're okay with this. This is what the state said to do it.
Did they? It just seems so like maybe if it was, unless and until the data shows that, or something. It's just so open. It doesn't, I would like to be able to say we're going to give it a little bit more of an explanation as to how we're going to decide when to rescind it, based on what. You know what I mean?
Don't you think, one thing that I find difficult sometimes is when people share stats and the statistics don't always tell the whole story. So I feel like to put something in when we have a certain rate or a certain statistic that is tricky too.
No, I get it, but at least have it be, our decision will be based on, current trends and data or whatever. So that it gives an explanation as to how we're going to make that decision, not like when we decide to do it.
I think if we're general like that, then perhaps we can say it because like if we said something, this mandate will be reviewed by the Board of Health at each subsequent regular meeting. Let's see. I don't know. It's just hard to figure out the wording, but we do want them to know that we aren't making this arbitrarily.
Right.
So we could say if no action, no. I just can't find the wording to.
But you know what I mean? Maybe it's just.
Well, if you wanted to add something to the effect between meeting and if no action, you could add something to the, that you're going to review or discuss all the latest COVID education statistics, data,
In order to make a decision whether to rescind or not, if no action is made, the policy stays in place, or
we could start that sentence with COVID trends and data, or COVID-19 data trends and information will be considered if no action is taken. I don't know.
I'm only thinking of, when we were dealing with the red, green, and yellow and all of that, and, it has to be 3 subsequent weeks and all this. At least it gave you some kind of a basis the decision was going to be made on.
Mm-hmm. Like a measurement. Sure. Yep.
And it doesn't have to be specific, like we want it to be at 0, because that's not happen. But at least have some kind of explanation how we're going to come to that decision. And it would be generic, but and I think too, maybe I'm just getting too far into the weeds. If we're okay with this in order to get moving, because we are going to look at it, if we want to, and I don't know if it's appropriate to just say we'll do this and then we'll fix it, but because I understand what everybody else is saying too. I just think it's just a little too open-ended for me, and I do get that comment.
I guess, like I said, I didn't want to tie it to the county rates, which is what most of the towns had done, because I think that I'm hopeful that we can come out of this before perhaps the county does. And that our town data is, and that of the towns around us. But so I just don't know the wording to put in.
Can I just say one thing, Stephanie? Because somebody is putting things in the chat about masks being dangerous or whatever. I go crazy as a nurse when people say things like that. They do not create health issues. Masks do not. So it's very hard when people say things that are just not true. And I ask people to be very careful of spreading. We can find anything on the internet to support our views. And we have to be very careful about the information we find. As a medical person, that is absolutely inaccurate to say that masks cause health issues. Remember that doctors and nurses in hospitals have been wearing them for years. So I beg people to share information that is accurate, not just found on the internet.
Thank you, Sue. And, I'm open if people have questions, and I have, many of us, but I'm willing to help talk to people about accurate data and understanding the scientific data. Joanne, you look like you want to say something.
Yeah, I just wanted to add, not to I guess the chat function is not for discussions among the people that are listening. And I'd appreciate if there wasn't back and forth going on, either pro, con, or not, or address, whatever's going on in there. That, if you want to have a back and forth discussion, do it out of our board meeting, please.
Thank you. Yes. Okay. So back to our discussion. Again, I don't know the language. I wish we had a good set of language or parameters, but we just don't really have that right now. If anybody has language to suggest, we can amend or change that.
Can I just ask something?
Mm-hmm.
All right. This mandate will be reviewed by the Board of Health each subsequent regular meeting. All pertinent data will be reviewed and discussed.
Sure.
No action is taken by the Board of Health to rescind. This regulation will remain in effect.
I'm fine with that. Is everybody okay with that? I can't see Michelle.
Absolutely. And also, we're having a special meeting tonight. We can have a special meeting anytime. We're not necessarily waiting for our monthly meeting.
If we can celebrate, we can celebrate.
Then we will.
Thank you. Yeah, I'm okay. Chris Sanders.
Yeah, Chris looks like he wants to talk. Go ahead.
Okay. Chris.
Hi. Thank you. Can you hear me okay?
Yes.
Okay, great. Thanks for doing all this. Good conversation. Sorry I didn't jump in when you guys were actually talking about the school language, but I think the one thing I would suggest, I was comfortable with striking 9. I too was trying to figure out the best way to word that. I think it might be good though, just to add the word schools also somewhere. I think number 1 might be a place. I know number 1 cites houses of worship. I won't necessarily tell you where to put it, but it might be good just so there's no misunderstanding that schools are included in this. That was my only suggestion. The other thing, which I think we're going to kind of be reckoning with in real time here a little bit, is that as of now, our pre-K preschool students are, I believe, mask optional. The state doesn't require it. I was trying to remember in my head. I was trying to remember if the superintendent may have included that in the recommendations we voted on, but I don't think that was the case. No. I think it's just recommended and encouraged at the pre-K preschool level. So that may be an impact. Just, a change from what we've been doing for the past month there.
Yeah, so that is interesting.
I'm not going to weigh in on that right now, but yeah.
Right. The superintendent it's EEC that governs daycare and home care, and not Riley, right?
No, I meant Westford integrated preschool.
Oh.
Yeah. So through WPS. So they are under the district. So anyway, I don't, without talking to the right people and having our committee talk and the superintendent, I don't have anything to say on that, except that it would be a potential change. And there may be, I could imagine from the school's perspective, it might be good to get some feedback on what that impact might look like how that's going to go. Obviously, last year we did masking. It wasn't optional, but things are different this year. We're in longer hours, et cetera.
So if we said schools ages 5 and above, that would then leave it with what the DESE guidance is without.
What if you just, because it says 2 and above, so if you did schools, day, and home care and just added those into the categories for indoor public spaces.
Right, but what he's saying is that so while daycares are now required to mask at 2 and up, the integrated preschool and preschools are not. Is that correct, Chris?
Right, it's recommended and encouraged.
But we're saying here, age 2, so that would include them as a town.
Right, so that's what he's saying, that would just be a change to them, that.
You know what? I personally think that age group should be wearing the masks, because that is where there's super spreader events with that age group, because they're all over each other. Chris, I appreciate what you said, that I like adding schools right where you said in all indoor public spaces, houses of worship, schools. I think if we leave it that way with age 2 years and above, we don't have to address anything. Now we're saying that you have to, in the preschool, you've got to wear your mask.
Okay, so.
Yeah, and I'm personally in favor. I'm personally in favor of that. I'm just saying I can't speak for our educators at that level. I can't speak for administration or school committee more broadly. Just
yeah,
it will be an impact. That's all.
Yeah, thank you, Chris.
Sure, thank you.
Okay, so we want to add schools.
Mm-hmm.
I don't know if
that would take care of it
in there. Okay. And so we're adding schools, and we're adding.
The permanent data will be reviewed and discussed.
Okay. Is there any other discussion about the language?
Yeah,
Yes.
oh yeah, go ahead, Ray.
Okay.
Oh, no,
You're gonna
sorry.
I think you're going to say the same thing I did, that we have to have a different date than tomorrow.
Oh,
Correct.
yes.
Yeah,
Right.
all the dates have to be fixed,
Okay.
because we didn't meet on the 23rd. We meet on the 22nd.
Correct. So what do you feel is fair for letting businesses know?
So
Now,
first we say September, or does that date change, the top one?
Well, it says
Right.
September 2022, first of all.
Right, okay. Oh.
next year.
Yeah, next year. We better not be doing this next year.
I hope not.
All right, so 2021, what date is reasonable? Monday?
Well, I do need to put it in the paper. And we do have listservs for our food establishments. We'll certainly put it out on all our social media platforms that we can possibly think of. I do just want to let people know that there is no business certificate listserv. I've checked. Just trying to think of every way to let businesses know. But again, our motivation is to educate people. So, with any calls or concerns of residents or folks visiting businesses in town, we'll just take one call at a time.
Ray, what do you recommend date-wise?
I would say at minimum a week.
I was thinking October 1st or something like that, but.
I was thinking the same.
That would be great.
And there's no reason why, they can't start implementing now. We don't have to wait.
Right, we already recommended that people be following this.
Is there a way to say by October 1st, everybody has to have this in place, or I suppose it's just, never mind. It's just like this effect. I'd like to see them start sooner, as soon as possible,
I actually, Joanne, I think that's perfect. So number one, you say by October 1st, instead of effective at 12:01, or something to the effect of by October 1st,
Yeah.
I don't
Like,
know.
start today,
Right.
start tomorrow, and buy.
Well, I know places like even Whole Foods, they've had a sign in their window for a long time, about they can't force you to wear a mask, but they prefer you wear a mask. That's what it's been in the window. So I think they'll be perfectly fine with saying, starting it tomorrow, but.
And we can certainly, we do have templates for signage if any kind of business does need assistance with that. We can post that on our COVID webpage and certainly bring them out with inspections if people need them and to help with that.
The only other thing to do is to have the effective date be sooner, but, have the enforcement date start October 1st. Is there a way to do that? Do you know what I mean? Like, start tomorrow, but we're not going to do anything about it until October 1st. There's no way to do that, right?
Zach and Ray are saying no.
That would be good.
Well, the problem is then that creates a lot of confusion. I mean, I understand where you're coming from. A lot of calls of when, and then we do have a lot of people that put the masks away. So, they have to order them and make sure they have them. And, to give the businesses a chance to, for us to at least get the education out.
Yeah. Okay.
So we'll go with October 1st, 2021. And then I guess, is there anybody who is willing to make a motion to accept this?
Oh,
with the amended, Joanne?
I just want to, because I know it was brought up as a concern that we don't have the ability to do this right now, but Ray, if you could speak to the fact that you spoke to council.
Yes, I did speak with town council today. A concern was brought up about the vote tonight. They have absolutely looked at our agenda, looked at the language, and in their opinion, have felt that a vote can take place. According to them, the Attorney General's office states that as long as you state that there is going to be a topic with a discussion, we did put that the draft mandate would be reviewed. Certainly a vote can take place at any time. In their opinion, agenda is to certainly be as specific as possible and transparent, but it's to let the public know that these items or these topics tonight, whether in old business, or, will be discussed at this meeting.
Thank you.
Mm-hmm.
I would be happy to make the motion with the amendments and the changes made.
Thank you, Sue. Any further discussion? Seeing none, is there a second? Michelle seconds.
All of us.
So all in favor,
Second, third, fourth, and
please
fifth.
indicate.
Aye.
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 Okay, motion passes unanimously. So we would love for people in the town to be wearing masks now, to do everything they can to protect people and help us bring our rates down. We passed that recommendation at our previous meeting, but beginning October 1st, we will be requiring masks in all public buildings and gathering places.
Indoors, yep.
Indoors, thank you.
And if I can just soapbox one more time.
Okay, Joanne.
I think too, we need to keep being reminded and reminding ourselves, it's not about us. It's not about me. What I do affects others. So you vaccinate yourself as your personal protection, but you do it to help protect others. We say that a lot about flu as well. And this is obviously a million times worse. This is not about us. It's about everyone. We do what we do to protect others, and especially those who can't be vaccinated, or even people who can't wear masks for whatever reason.
Thank you.
So, just remember that bigger piece of this.
And I continue to remain optimistic. There was discussion today that they hope and they think that we're going to, with vaccinating children, be able to get past this Delta variant and see improvement in the not distant future. And I choose to be optimistic that that hopefully this mandate won't be in place for very long.
But this is what vaccines do. And we've been talking about COVID, but we have vaccine mandates in school. This is why, we have kids vaccinated for all kinds of things. And it's not, it's about them individually, but it's about us collectively as a community.
Yes.
And, this is what you need to do to get into public school. You have to have, certain vaccines on board. And, it plays into that same whole thing. It is about us as a community.
Thank you.
Can I just add to that? Thank you for saying that, Joanne,
Sure.
because my struggle has been, I work as a school nurse and there's certain vaccinations they have to have in order to be in school. I am just blown away by how much controversy has been over this vaccine. It is mind boggling to me. It really is. So thank you for bringing that up, Joanne.
Okay, well, if that is the end of the agenda, yes?
It is. Yep.
Do we have a motion to adjourn? Is that
Once I
Joanne?
mute myself.
Joanne makes the motion. Is there a second?
I'll second.
Sue seconds. All in favor? Say aye.
Aye.
Hi.
All right. Thank you, everyone.
Thanks. Thanks, Stephanie.
Thank you,
you.
everybody.
Bye, guys.